Hello, my name is Teresa Turner, and in this presentation I will discuss the risk factors of vulnerable populations and present the interrelationships between them. Here I've listed a few vulnerable populations, such as those that are below the level of poverty, the homeless, those that suffer from addiction and violence, those that suffer from mental illness, infectious diseases, and the rural and migrant health population. Healthy People 2020 talks about the social determinants of health and the vulnerable populations at most risk. Here, I'm demonstrating that the poverty, those that are in poverty tend to be the homeless. Some of the risk factors of the homeless would be that they are exposure to environmental hazards because they lack shelter. They have a limited community resource. They lack food and water, which in turn leads them to lack of proper nutrition. And their lack of shelter also leads them to not having any place to bathe. And all these risk factors lead to a high risk of infection and diseases. Along with the rural and migrant health population, they also live below the poverty level. They are also lacking in education, language barriers, and they're also isolated from urban societies. They too have limited healthcare resources. They're underinsured, or they have no insurance at all. The homeless and those that live below the poverty level and those that are rural and migrant health also have a lot of the same disease processes that are uncontrolled, such as diabetes, hypertension, heart disease, COPD, cancer, and dental caries and infection. Another vulnerable population that does overlap with the homeless and those that live below the poverty level is mental illness. Now, not everybody who's homeless has mental illness, so there is also a mental illness population out there that suffer from untreated schizophrenia. They also suffer from untreated antisocial personality disorders, and there's also a population that suffer from post-traumatic stress disorders, whether it's from military active duty or from being involved in violence or violence in the home. Also, a risk factor for people with mental illness, a lot of them have also issues with addiction and risk factors and risky behaviors due to addiction. And they are also at risk for violent behaviors, such as they are also victims of violence and rape because they live, on their, outside of communities that have proper not only healthcare but proper police in the area. And they also are engaged in their own little communities, like in tents, and they tend to have their own little culture within those little communities. There's a population in San Diego that is actually called Tent City that lives under the overpasses in tents. And again, they're exposed to a lot of the environmental hazards. There also is an alcohol and drug abuse risk factor, and then there's also criminal behavior that's related to drug and alcohol abuse. Behaviors such as stealing for drugs, and also things like panhandling, and then also stealing for being involved in drug trafficking and drug dealing for money and for their drugs. This in turn, mental illness are related to addiction and violence, and then mental illness also can lead to, because they have poor impulse control, a lot of times they engage in risk factors such as unprotected sex. There's also sexually transmitted diseases, HIV, hepatitis, related to drug use, and in turn brings us back to infectious diseases, which again are the same as the ones that I mentioned there under the uncontrolled diabetes, hypertension, heart disease, COPD, and cancer, and also dental caries and infection. And again, all these populations do have a limited of healthcare resources. They're usually underinsured and they have no insurance. Thank you, and that is the end of my presentation.